Hello, everyone. Thank you for joining me tonight. My name is Andrea, and we are going to discuss how malaria affects various nations across the world and what is currently being done to help prevent any further spread and infection of this disease. So, what exactly is malaria? Malaria is one of the world's oldest and most persistent infectious diseases. For over 5,000 years, it has truly shaped human history and continues to take hundreds of thousands of lives every year. Malaria is caused by a microscopic parasite known as Plasmodium and can only be transmitted through the bite of the Anopheles mosquito. Now, malaria tends to thrive in warm, humid climates, such as those found in Africa. And when someone is infected with malaria, they tend to display symptoms that can start off mildly, such as fever, chills, and fatigue. However, without treatment, the disease can quickly become life threatening, leading to convulsions, jaundice, and organ failure. Now, despite decades of progress, malaria does still affect millions of individuals today. Africa alone accounts for about 94% of all global infections and 95% of malaria related deaths. In this presentation, we're going to go on to explore how malaria and humans have evolved together and how burdens differ across the world and what policies like new vaccines are changing the fight against this disease. Now, as I mentioned on the last slide, malaria is not caused by a virus or a bacteria. Instead, it is caused by a parasite, specifically one of five Plasmodium species that are known to infect humans. When an infected mosquito bites somebody, the parasite will enter the bloodstream and travel to the liver where it multiplies before invading red blood cells. The cycle of infection and cell destruction can lead to, again, high fevers and chills that malaria is typically known for. Without prompt treatment, the infection can again lead to anemia, organ failure, or even death. So, environmental conditions play a huge role in transmission, such as the high rainfall and warm temperatures that are found in Africa. This creates the ideal breeding ground for mosquitoes, which is why these southern continents tend to have the highest occurrences of the disease. In addition to the perfect breeding grounds for mosquitoes, limited access to insecticides and proper health care allows the disease to spread unchecked, especially in children under the age of 5. So, unfortunately, malaria is just as much an environmental and socioeconomic issue as it is a biological one. However, it is preventable and is treatable with the right access to healthcare. Now, over thousands of years, humans and malaria have pretty much been locked in an evolutionary arms race. The malaria hypothesis suggests that genetic traits can give partial protection from malaria, and these traits have become more common in populations that are constantly exposed to the parasite. One more famous example of an adaptation that can lead to partial malaria protection is the sickle cell trait. When someone displays a sickle cell trait, they have a single genetic mutation that will alter the shape of red blood cells. So rather than having a nice round shape, they have more of that bent or sickle shape. People who carry one copy of the mutation, HBAS, which can lead to sickle cell disease, are less likely to die from malaria because the parasite cannot survive as easily inside one of those altered cells. Another example of an adaptation that can provide some protection against malaria include thalassemias and G6PD deficiency. Both of these adaptations interfere with the parasite's ability to basically thrive and survive within human blood. These adaptations are just powerful reminders of how deeply malaria has influenced human evolution. Now, malaria, in response to these adaptations in humans, has also evolved too. The Plasmodium parasite has developed a couple different ways that it is able to survive inside of humans. One of their most effective tools is a protein that is known as PFEMP1. Now, this protein helps infected blood cells kind of stick to the blood vessel walls to avoid being filtered out by the spleen. The parasite is also able to change the antigens that are found on the surface of the cell, making it really difficult for the immune system to recognize the parasite and attack it. This coevolution between the host and the parasites, so humans adapting for protection and malaria finding new ways to resist that protection, is what makes elimination of the disease such a complex challenge. Now, when we are really looking at malaria's global impact, one thing that we can do is compare different countries, such as one that is a high burden country like Nigeria and a non endemic country like the United Kingdom. And the difference between these two locations can be very dramatic. In 2024, for example, Nigeria accounted for roughly 25.9% of global malaria cases and 30.9% of deaths. Now, children under 5 and pregnant women did face the highest risk for infection. In contrast, the United Kingdom reported having just 2,106 cases and 6 deaths. Now, all of these cases were linked back to individuals who traveled internationally. These two countries really highlight malaria's unequal global burden, where geography, climate, and resources truly dictate who is the most vulnerable to infection. While Nigeria battles constant transmission, the United Kingdom's focus is simply on preventing imported infections from international travelers. Now, one major breakthrough in recent years is the rollout of the RTSS malaria vaccine for children under 5 in these high burden regions, such as Nigeria. Nigeria's national immunization program, with the support of the Gavi and the World Health Organization, have begun implementing this new vaccine to reduce deaths and severe cases of infection. Pilot studies in Ghana, Kenya, and Malawi showed very promising results. They did notice that there was a 32% reduction in severe malaria hospitalizations and a 9% drop in all-cause mortality among vaccinated children. The RTSS vaccine is not something that stands alone, but rather part of a large public health strategy that also includes insecticide-treated bed nets, as well as seasonal malaria chemo prevention to try to decrease incidence of the malaria infection. Now, while this is a major milestone, it is not perfect. RTSS does require 4 doses of the vaccination. Otherwise, protection can fade if doses are missed. This, unfortunately, is a common problem in rural areas that have limited access to clinics. Vaccine effectiveness also decreases over time, so it must work alongside other tools. Researchers are now combining the RTSS vaccination with seasonal chemo prevention, as well as exploring next generation vaccines like R21 and PFSPZ for even stronger immunity in immunized individuals. However, the success of this will still depend on reaching every child, improving logistics to have access to the vaccination, and the maintenance of long-term funding. While malaria is both ancient and adaptable, science, policy, and collaboration are closer than ever to rewriting the story. Vaccines, mosquito control, and community education are all working together to bring malaria deaths to record lows. The challenge now, however, is sustaining that momentum and ensuring that the most vulnerable populations, such as those in Nigeria, receive protection and that no child dies from this very preventable disease. Malaria's history is one of resilience, but so is humanity's. And with continued global commitment, eradication of this disease is no longer just a dream, it is within reach. Thank you all for joining me, and hopefully, you learned a little bit about malaria.